Hello everyone, my name is Tracy Farraher and I'm an epidemiologist at the University of Manchester. I use data to explore what factors are associated with health, as well as differences in health between different communities and what interventions work to reduce these inequalities. This presentation is part of the European Public Health Week of the 13th to the 17th of May 2019. Which is led by the European Public Health Association to raise awareness of public health and celebrate healthy populations. In this first ever European Public Health Week, there are a range of events and activities all over Europe, with each day dedicated to an important public health theme. Each day I'm going to provide a quick summary of some of the evidence of the health benefits for each day's topic, with links to further information. I hope this provides you with a short introduction to the importance of each day's public health theme. So on the second day of European Public Health Week, the theme is Healthy Environments, with the motto of the day being Healthy Environments Make Healthy People. The sub-themes for today are urban health, air pollution, green zones, blue zones, water and sanitation, road infrastructure and road safety, healthy communities and neighbourhoods. We're not going to look at all of those, but today we're just going to look at the evidence for the health benefits of improving the environment. So according to the World Health Organization, who have systematically analysed and quantified how over 100 diseases are impacted by environmental risks, they estimated that in 2012, 12.6 million deaths globally, representing 23% of all deaths, were attributable to the environment. When accounting for both death and disability, the fraction of the global burden of disease due to the environment is 22%. In children under 5 years, up to 26% of all deaths could be prevented if environmental risks were removed. The WHO were also able to detail the regions and populations most vulnerable to environmental mediated death, disease and injury, with the highest fraction of deaths and disease that could be tackled through environmental improvements being in low and middle income countries, with over 30% of global deaths attributable to the environment being in the Southeast Asia region and just under 30% being in the Western Pacific region. The WHO defined environmental risks to health as all the physical, chemical and biological factors external to a person and all related behaviours, but excluding those natural environments that cannot reasonably be modified. To give you some examples, these include the pollution of air, water or soil with chemical or biological agents, ultraviolet and ionising radiation, noise, electromagnetic fields, occupational risks that include physical, chemical, biological and psychosocial risks, and working conditions. The built environments including housing, workplaces, land use patterns and roads, agricultural methods, man-made climate and ecosystem change, and behaviour related to environmental factors such as availability of safe water for washing hands or physical activity fostered through improved urban design. The WHO were also able to look at specific conditions in terms of DALYs, which are stats that try to combine years of life lost and years lived with disability so that you can compare the disease burden across diseases. They found that the diseases with the largest environmental fraction include cardiovascular diseases, diarrhea and lower respiratory infections, Ambient and household air pollution and water, sanitation and hygiene are the main environmental drivers of these diseases. Thank you so much for your time. Further information on the impacts of the environmental on health, as well as today's sub-themes, with listings for the events for today and the rest of the week, can be found at the European Public Health web pages at eupha.org, including links to my other evidence summaries. To get in touch with me, I'm based at the Division of Population Health, Health Services Research and Primary Care at the University of Manchester in the UK, where I'm also a member of the I3HS Hub that aims to improve population health through data sciences. You can follow the Hub at I3HSH and myself on Twitter at @tfaraher. Again, thank you, and I hope you have found this quick summary of some of the evidence of the health benefits of improving the environment useful.